Have you ever wondered if large employers get a better deal on healthcare costs? You would be right, they do. Would you be surprised to learn that you could buy healthcare the same way that they do? By the end of this video, you will know exactly how to do just that. Hi, my name is Allison DePauli, and I started Altiqe Consulting to help employers get out of the healthcare craziness spend and back into running their businesses. We help employers like you add predictability and control back into your healthcare budget, and the happy side effect of that is lower out-of-pocket costs for your employees and better access to high-quality care. Our clients don't hear, well, the best we could do is a less bad renewal. Our clients hear, your employee had access to the highest quality care and you paid a fair price for it. For the best advice on how to shrink your benefits budget, make it predictable and repeatable, and more cost-effective for your employees, subscribe to my YouTube channel below and hit the notification button to be notified when a new video is uploaded. So, what is a direct contract? A direct contract is simply an agreement between a facility or a group of facilities and a provider to deliver care for a previously agreed to price and how quickly the hospital or facility will be paid. Large employers and a few very special third-party administrators, people that help self-funded employers manage their plans, use these contracts to control the cost of healthcare immediately and over the long term. This helps both in budgeting, ensuring that you know what kind of care is going to cost what kind of dollars, and it helps you ensure that your employees have access to the highest quality care. You'll hear me say this often. High quality care is the most important element of any plan. Not only is it the right thing to do, it is the best way to control your costs, both in the immediate, because high quality care is usually less expensive, and in the long term, less side effects, better outcomes, your employee returns to work more quickly and can get back to doing their job and helping you run their business. There are a few components of a direct contract: what services are covered, what the reimbursement level is, and how quickly the provider needs to be paid. Do you have long-term contracts for other costs in your businesses? Maybe equipment you lease or pay for over the long term, or copying equipment. That's a pretty simple thing to lease. You know what the cost is going to be. Direct contracting is the same concept. Would you be interested in learning more about how to do this in your own business? If so, click the link below. So let's talk for a minute about why payment terms are so important. Two problems that hospitals have, and we'll talk about this in another video, is revenue cycle management. Hospitals are businesses. They need revenue to run their operations. And member responsibility. One of the largest revenue cycle problems that hospitals have is the member responsibility often goes unpaid, and that is initially the first $1,500, $2,500, $3,000, $5,000. So they have a hard time managing their budgets. However, if you come to a facility and you say, I can deliver this many patients to you, how can we negotiate a fair price? Assuming that the price is fair and the payment terms are quick, you will probably find pretty receptive facilities. Not all, but some that will be very receptive to that. And the ones that are probably delivering a high quality product to start with, as they know what their costs are. So remember when I said earlier that some TPAs or third-party administrators have direct contracts? As a smaller employer, you might not have enough employees to go to a facility and say, could I have a discount? When you use the services of a third-party administrator who has a direct contract, or an advisor who has negotiated a direct contract on behalf of their groups of employees, you do have enough volume and you have the opportunity to take advantage of some less expensive pricing and some access to better quality care. You do have to be in a self-funded arrangement to do that. So bundled pricing is related to direct contracting, and I've included to that in the video below. If you're a smaller employer and you're not ready to go the direct contracting route, sometimes a third-party administrator or an advisor will have access to a company that will do a bundled one-time price, and that can also be a pretty effective way to control your costs. If you have questions about direct contracting, or if you're interested in saving your plan significant dollars, making it predictable and controllable? Click the link below and let's see if we're a good fit.